So we can start. We are live on YouTube.
Okay. All right. So good afternoon, everybody, and welcome to the IMA Healthcare Alumni Special Interest Group webinar series. As you know, the alumni special interest groups at IMA are platforms that bring together alumni, faculty, and students and leverage the collective intellectual resources engaged in healthcare, public policy, and many other areas to bring to bear on some of the most challenging issues of our times. The ASIG platform allows faculty, alumni, and students to collaborate with each other much more intimately and to engage with industry and practitioners in a more multifaceted manner. The ASIG webinar series itself brings the thoughts, views, and expertise of renowned experts to the IMA community. In earlier parts of this series, we have addressed industry-government collaboration, emerging digital healthcare scenario, investors' perspectives on opportunities in healthcare, Ayush, reimagining the future of healthcare, consumer healthcare, and startup opportunities in healthcare. As you know, the past couple of years have presented several extreme shocks to the system, and the pandemic has led to many tragedies, but it has also seen a far larger number of people fighting back. And that has resulted in a wide variety of responses to the challenge. The Indian Council of Medical Research under Dr. Balram Bhargava has been at the center of India's response to this enormous challenge. In addition to managing the aftermath of the pandemic in its several manifestations, one of the most formidable challenges was the development of an effective vaccine. Now, Covaxin has come as a godsend to hundreds of millions of people. And the story of development of Covaxin is as incredible as it is inspirational. Who better to have to share about this story than Dr. Balram Bhargava, author of Going Viral, the story of the development of Covaxin. Dr. Bhargava has had a long and illustrious career, and he's a professor of cardiology at AIIMS, New Delhi, executive director for Stanford India by Design Center, Secretary Department of Health Research, Ministry of Health and Family Welfare, and Director General of Indian Council of Medical Research, to put it in a few words. Welcome, Dr. Bhargava. It is a pleasure to have you with us today.
Thank you.
We also have with us Professor Arvind Sahai, Professor of Marketing at IMA. Welcome, Professor. We look forward to an exciting session. Now I hand over the platform to Professor Sahai to take over the proceedings.
Thank you, Anurag. Good evening, Professor Bhargav. It's such a mouthful. Professor Bhargav, Dr. Bhargav, Secretary Bhargav, Director General Bhargav.
So kind of you. Yeah.
So thank you very much for taking the time today to be with us. And I thought I would take the liberty of proposing the following structure to you for the conversation today. We have your book over here with us. And through the good offices of Anurag and Navneet, I was able to get it yesterday evening. And so my yesterday late evening and early morning today was actually spent perusing through this. So with your permission, what I'm going to do is I have picked up a few points which you have mentioned. By the way, it tells the story very nicely, beginning from January of 2020, when 2020, when we first felt, okay, it is coming, and 30th of January, first case is identified, and then chronologically as different things, events unfold. So what I was hoping to do was to touch on various themes as they occur in the book, almost in sequence in the book, and perhaps ask you some questions about them, if that is okay. And then maybe we can have a conversation around those themes in the book, and with a particular focus on some ideas going forward. Much has already happened, much water has flowed under the bridge. We have done reasonably well, all things considering, given the state of the health infrastructure in the country, under your guidance and that of the government of India. And So what next is something that I would like to be able to focus on. So if I may start at the beginning, where you are sitting with the government and you are proposing on page 8 of your book, you were asked to give a proposal and you wrote 2 lines over there. Have a lockdown and stop international travel. So what was going on in your mind at that time when you made those fairly significant, almost one might say at that point in time, extreme proposals to the government?
I think, would you like to do it as a question and answer session, or you want me to give a small presentation and then we have the question and answer? Would that be
whichever you feel more comfortable with, Dr. Bhargav?
I'm comfortable with both, but the question is that the people may not have read the book. So yes, if I just give a small presentation, then the perspective would be much more
fair enough. Absolutely, please feel free.
I will share some slides and
maybe about 15 minutes or so for the presentation.
15 minutes should be enough, if that's fair, and then we come to the questions.
Thank you so much. Please go right ahead.
So I'll just share the slides. Thank you. I hope the slides are visible.
Yes, very much so.
Yeah. So thank you. First of all, it's absolutely an honor to be present here. Thank you, Professor, for inviting me to this book discussion and tell the story about Covaxin. It's an honor to be present at the Indian Institute of Management, Ahmedabad, which is one of the greatest institutions which has contributed immensely to nation building and has contributed immensely, and people like you have led a lot, trained a lot of students and who have contributed to the nation. Now, I will tell this little story about Covaxin going viral, and this is the inside story. So, and you described that we had the first case in January of 2020, 30th of January. But before that, I will just give 1 or 2 slides about the Indian Council of Medical Research, where I am working at the present moment. And this was founded in 1911, one of the oldest science research bodies in the world, actually. And it conducts and coordinates medical research connected to the 600 medical colleges in the country. It's sort of the footprint of this organization of the last 100 years is quite well established across the country, from north to south to east to west. And this has been responsible for, right from 1918, the Beriberi inquiry, to the first malaria survey in 1938, then 1942, the Kala Azar cycle, then the 1959, the domiciliary treatment for tuberculosis. And at that point in time, the first prevalence survey of tuberculosis was done. And we've just, as we speak, completed the second prevalence survey for tuberculosis in the country, which has been done after a span of 55, 60 years. And that is going to be highlighted very soon in the next few weeks about what is the problem of tuberculosis in the country. Then the first polio vaccine in 1963. Then we talked about oral rehydration therapy, India's first test tube baby, and double fortified salt with iodine in 1994, and that has contributed immensely to the prevention of thyroid disorders in the country. Now we know that COVID-19 has wreaked havoc in the country, disrupting economies, disrupting health systems, putting us in an unprecedented speed to really achieve a lot for treatments and for the vaccines. And you know that as a nation, as you clearly said in the beginning, that we have done quite well. And that is because of the fact that India is the being the largest democracy, recalibrated its intervention as needed. And since in 2020, we were slightly behind in terms of the Western nations, in terms of the pandemic coming to our country. We were about 2 or 3 months behind, so we could learn a lot from the West, what they had dealt with in the first 2 or 3 months of the pandemic. And it was a whole of government approach, which was calibrated, proactive, preemptive, and we were serious from the beginning, which was quite interestingly very much science-driven, and we did not play around with herd immunity at all, as many countries did in the beginning of the pandemic. United Kingdom, Sweden, many developed nations also talked about herd immunity in the very beginning, and they faced dramatic consequences because of that. So we were the 5th country in the world to isolate the virus on the 9th of March 2020, and we shared the virus with Bharat Biotech in the month of April, and then there is no looking back, and I'll talk about that story. Now, we also were the first country in the world to isolate the alpha variant in January of 2021, and then we also cultured the Zeta, Beta, the Kappa, and also the Omicron variants more recently, and cultured it, and also shared with different science agencies to develop drugs, to develop products against this virus. We also shared it with Bharat Biotech to develop the vaccine and further tweak the vaccine if need be. But as you rightly said, the first case was a medical student who traveled from Wuhan to Hong Kong to Calcutta to Bangalore and Cochin, and then by bus to his hometown in Kerala. It was the first case on 30th of January, and at that point in time, we had to really be doubly sure, triply sure, 100 times sure that the virus has entered our shores, and that was done at the National Institute of Virology, at the Maximum Containment Laboratory, or the BSL-4 laboratory, which was the first BSL-4 laboratory in Southeast Asia region, established in 2012-13 in India. And the Wuhan lab, which is the second one in Southeast Asia region, was established in 2017. So then we started, we had very limited resources for testing. We had limited kits. We were getting them from different countries. The WHO gave us some kits. We got them from some parts of Europe, from USA, from China. And it was really a seller's market at that point in time. And they would give the kits, handful of them, and we had to take a decision to buy them within a few hours. Otherwise, they would divert them to some other country. So that really ignited in the month of February, March, that our youngsters and young innovators should start developing the kits. And we handheld the young innovators with other science agencies to develop startups, to develop newer kit manufacturing facilities. And by August, September, we were exporting kits, and India really, it was history as far as this was in 2020, as far as looking at kits for RT-PCR testing. And as you can see that in February, we were only doing RT-PCR tests, and we had another test which we were using for tuberculosis testing, which was the Tuna Test, which was again an indigenous product developed by the Indian Institute of Scientists from Indian Institute of Science. So it is a startup funded by DBT, funded by CSR, funded by ICMR, and they developed the TB product, which was WHO pre-qualified. And we used it for the first time for Nipah virus. We used it for the first time in the world for leptospirosis, and we quickly repurposed it for COVID-19 in the April of 2020. And this a similar testing kit was developed in the West in September, October of 2020, called the DNA Nudge in the United Kingdom, and several 2-3 other countries developed it much later. So this was in April of 2020. And then in India was the first country really after Korea to use the rapid antigen tests during the first wave in New Delhi. And that was used in June of 2020. And then that rapid antigen kits were rapidly used. And gradually we opened up our testing strategy from travelers to contacts to pool testing to hospitalized patients to immunocompromised. And by September of 2020, testing was available on demand in the country. More than 700 million tests have been done, more than 3,200 molecular testing laboratories. Our national test average is more than what recommended by WHO. And the cost of the RT-PCR tests have been reduced tenfold to about $2 per test. And the rapid antigen test is $1 per test. And we have also now the home antigen tests also available. This is about the Tuna Test, which is a portable battery operated kit, which we were using for tuberculosis. And many of these machines were available in different districts, and they were rapidly converted to COVID testing in remote areas and in areas where we could not have electricity. We could carry these battery-operated kits. Then we also passed a Gazette notification that every medical college should set up a PSL2 sort of a viral testing laboratory in June of 2020, on 9th of June. And rapidly, these medical colleges set up a molecular testing laboratory in each of these medical colleges. Now, this was another interesting phase that we had the lockdown, and you alluded to the two lines that are mentioned in the book on page 8, where we talked about that we should impose a lockdown, a tough decision. And this lockdown from 24th March to 31st May, the 4 phases, we had a mission lifeline run in partnership with the Ministry of Civil Aviation, Indian Air Force, Government of India, with the Indian Railways and the India Post and the ICMR. This was a 24/7 mission to carry out consumables, testing commodities, and medical supplies to various parts of the country. And in preparation for the approaching storm, the government imposed a nationwide lockdown on the 23rd of March, 24th actually, 23rd was a Janta curfew, and then the lockdown. It was probably, in retrospect, probably the most effective of its kind anywhere in the world. Really, as one would say, a Buddha's middle path, a balanced one, compared to the very stringent one in China and the very lax one in most parts of the West, whether it's Europe or the USA, where people continued to ignore the use of masks, continued to ignore the restrictions of their lockdowns. And this was very useful in the fact that we were able to distribute the first wave and prepare our health systems in terms of hospitals, beds, and oxygen, etc. And that was very useful at that point in time. And what were the learnings? Were that our mantra was to keep the windows open and the doors shut, and that's how I've written it in the book. The knowledge from different parts of the world would come in, we would consolidate them for action. And that is what was the little bit about the lockdown, which I wanted to allude to. In terms of the testing, the other thing that we had in February was that we had a lot of our Indian citizens stranded in different parts of the world, whether it was Italy or Japan or China or even in Iran. Many of them had to be airlifted in February and March and put in quarantine facilities, which were created by the Indian Army, by the ITBP and Border Security Force, other agencies which set up these quarantine facilities. And in retrospect, if you look at those facilities that were rapidly created in and around Delhi and Rajasthan and various parts of the Jodhpur, etc., they were really very useful to bring in all our Indian citizens who were evacuated. And there was another interesting story where we had some Shia pilgrims, some 6,000 of them, stranded in Iran in February of 2020, and we had to get them back to India. So we had to test them, test whether they were negative, and then bring them back to India. But so there was very limited facilities available in Tehran. So we had to immediately, overnight, ask 6 of our scientists to leave and go to Iran and set up a lab there. They went with caseloads of equipment to set up the lab. They couldn't get facilities on hire to set up the lab because at that point in time, the epidemic had started raging in Iran and Italy. So we set up the lab in the basement of the Indian embassy there and tested samples, and all those who were negative were immediately sent by Indian Air Force and Iranian Airlines for repatriation, and those who were kept were positive were kept in a quarantine facility there, 250 or so odd of them, and then they were shifted later on. So this was an interesting experience for ICMR, which had never done this kind of a thing internationally, having done it a lot within the country in terms of response for various epidemics. In terms of science, there was the convalescent plasma was being used and had been used over the last 100 years for various viral diseases without a definite answer whether it is working or not. over the last 100 years. And we rapidly embarked on a very systematic trial in the month of April to July, and recruited 464 patients, randomized them into convalescent plasma and the control arm, and clearly demonstrated that it is not working. This is the first largest trial on convalescent plasma not working across. And if you were to ask me what were the 3 or 4 important contributions in terms of treatment for COVID-19, I would say this was one. As far as the world was concerned, clearly demonstrating that this is not working. Steroids from the United Kingdom, where they demonstrated that their low-dose steroids are working, and remdesivir also by the WHO, which was initially shown to have reduced the hospitalization. I think other than that, and then oxygen, other than that, really, none of the really major antivirals were found to be effective or any other drugs. And these were the major scientific contributions other than the vaccines, which were later on developed. This was published in a very prestigious journal, the British Medical Journal, with 2 editorials talking about how research was democratized, not only from the ivory tower institutions of India, but into district hospitals, wherein we were able to conduct this trial by VCs and recruit. The national sero surveys, 4 rounds of them were done, which gave us a clear picture of where the country is standing in terms of antibodies, and the last one in June, July last year demonstrated that 66% of the people had antibodies, and more than half of the children also had antibodies. And this was conducted in the same 70 districts, same 700 villages across 21 states, and selected on a population proportionate to size basis. And these were published in different journals. The Genomics Consortium was created with the CSIR, the DBT, the ICMR, and the Ministry of Health for looking at the different variants. And the most important I would talk about is the public-private partnership, which was the COVAXIN, which is a collaboration of ICMR with Bharat Biotech as probably one of the strongest private-public partnerships, wherein it built on the pillars of trust, transparency, timeliness, and mutual respect for each other in terms of the capabilities and the prowess that each of these organizations possessed. And the environment at that time was ready and charged with possibilities of and the time was demanding, and we were able to do that, develop the vaccine. And as I mentioned, we'd handed over the virus to Bharat Biotech in April. They came up to us with the vaccine in the month of May, which we tested on small animals, the rats and mice, and demonstrated its efficacy. Later on, we did work on hamsters, and the most important part was the unsung heroes, which were the 20 monkeys, when we did the monkey trials. And these 20 monkeys are responsible for the COVAXIN success story. We, as a nation, do not have major breeding facilities for monkeys, so we had to capture these monkeys from the wild for testing. Once we captured, we got all the permissions. During the lockdowns, there were monkeys not available in and around the cities. They had migrated to the forests, so we had to send a team of ICMR and IV with the forest department to the borders of Telangana, Maharashtra, and Karnataka, and we were able to find success near the Nagpur forests to capture these monkeys and then rapidly test them for their health by tuberculosis tests, x-rays, blood tests, again at the air-conditioned facilities at the maximum containment BSL-4 facility in Pune. And once we, here the important thing was the monkeys were vaccinated with the vaccine, which we did not know how effective it was, how safe it was. Then the monkeys had to be given a challenge of the virus. And for that, we had to do bronchoscopy for those monkeys. And we had one pulmonologist at our facility, at our headquarters in Delhi, and we flew him in an Air Force plane to Pune. And this is all during the lockdown. I'm talking about May, June. And then in May, June, the monkeys were captured. This gentleman, the doctor, went to the Pune. We got help from the the CTC facility in Pune as well, the army facility, and a pulmonologist from there did bronchoscopy of the monkeys under anesthesia and gave them the live virus inside their lungs. Into the third generation bronchi, into their lungs, the virus was given by bronchoscopy in anesthetized monkeys. Then these monkeys were kept, and after 7 days, the samples were collected again by bronchoscopy in anesthetized monkeys on day 7, day 8, day 9, again by bronchoscopy to see if the virus had grown in the lavage that was taken out, or the solution that was taken out from the lungs and evaluated. Later on, these monkeys were sacrificed, and their lungs, their kidneys, their heart, their brain was studied for safety and whether the presence of virus in any of these parts. And I think that was the turning point for the vaccine. Then we were able to carry on with the human trials, the phase 1, the phase 2, and the phase 3, and then the rest was history. And probably this was probably the most important point that helped us. And these were published in various journals, the preclinical studies on mouse, rabbits and rats and monkeys and hamsters, and then the Lancet, the first phase 1 on 375 volunteers, the phase 2 on 380 volunteers, and the phase 3, the largest trial on 25,800. And we were able to get approval for the vaccine on the 3rd of January 2021, and 16th of January, the vaccine rollout started in the nation last year. And we scripted history by getting WHO approval on the 3rd of November of 2021. And now this year we have started vaccinating children and the precautionary dose, and we've looked at its neutralization against the alpha, beta, delta, zeta, and the kappa viruses. Also the Omicron, not that effective against Omicron. There is a fair amount of escape of this vaccine and other vaccines with Omicron. However, serious disease, death is definitely prevented. So India, known as the pharmacy of the world, now probably a vaccine superpower. With Covaxin, we proved that we could manufacture vaccines in record time from start to finish. That was a little bit about the vaccine story. On 18th of March 2020, we also notified a national task force under the leadership of the Niti Aayog and the ICMR and the Ministry of Health to the Supreme Court. And this national task force was responsible and meeting. We've met more than 150 times actually in this last 2 years for calibration of testing strategy, advice government on lockdown and containment strategies, provide insight on ongoing research, and explore newer repurposed treatments. And we published several guidelines, advisories. We published 5 issues of the COVID journal, the Indian Journal of Medical Research. And as you can look at the several publications, more than 250 publications we've had and contribution to the world literature on science on COVID-19. We gave the management protocols from time to time, the one-pager on the national treatment protocol and the home isolation protocol, which has recently been revised again, talking about home isolation, which is the backbone for Omicron, asymptomatic contacts to be in home quarantine for 7 days, symptomatic individual in home isolation is 7 days. And this was translated in 14 languages and put up on the websites. If you look at the top 10 highlights, we would say the countrywide scaling up of testing, diagnostic kit self-sufficiency, serosurveys, indigenous vaccine development, preclinical animal studies, international standards, treatment diagnostic guidelines, socio-behavioral research on stigma, vaccine hesitancy, and innovative service delivery by the use of drones in collaboration with IIT Kanpur, and subsequently some startups were able to help us with reach out to hard to reach areas. And we have the iDrone program, which is the ICMR drone response and outreach in the Northeast. We did several sorties of giving vaccines in Manipur, Nagaland, and other states of the Northeast, including certain medications which were delivered in matter of minutes, which would have taken several hours. And I think this has really been a game changer, as served as an opportunity to look at newer things and newer opportunities. So we have achieved a feat for 1.4 million, largest, fastest vaccine drive ever. The United Nations has recognized us as that. 95% of the adult population has received one dose. 75% are fully vaccinated. More than half are women, more than half is in rural areas. And these vaccines have been scaled up in record time. How has this happened? And I think the political will strong from top to bottom, and India having a very strong universal immunization program for the last several decades, with vaccinating 27 million newborns, 100 million boosters per year, with 28,000 cold chain facilities. I mean, more than 2.3 million ASHA frontline workers, millions of doctors, nurses, ANMs, with more than 3.5 lakh vaccination centers, with vaccine manufacturing with several companies, which we have Serum, Bharat Biotech, BioE, Cadila, Panacea, and the IT prowess, the CoWIN, an open source successful platform, which has been giving such excellent certificates right up to the precautionary dose for everyone, and people's participation in self-help groups and sophisticated digital strategies have helped. And if you look at this little graph, which is really explaining how we have faced Omicron very well in the month of January 2020, if you look at the case fatality rate from April 2020, it has gradually fallen, but it was high again in May, June of last year. And then as our vaccination, the orange line started increasing, vaccinating 75% of the adult fully vaccinated of the adult population, and the case fatality rate is nearly touching zero, really very low, as we see. Partly related to our vaccine, partly related to the strain, but Delta is also still there in some parts of the country, so that will not explain everything. It was a whole of government approach with the cabinet secretary and now the health minister, and also the health ministry under the leadership of the government, with state governments, drug controller, the science and technology departments, the NCDC, the surveillance officers, district surveillance officers, who have really contributed to this. So what is one or two slides about inspiration for the Gen Next, and I would really like to take this opportunity, because your institution has really contributed tremendously to several national education policies, as well as the business community in the country. So if we could encourage the following in our school curriculum: fiction writing, applied mechanics, and that is inventing, filmmaking, Latin or probably Sanskrit, multi-religious theology, and that is what I feel most of our science institutions lack, social sciences, and that is important, history of philosophy, sports, chess, music, martial arts, yoga, research-oriented curriculum. So in this 75 years of independence, if we could encourage these in our curricula, that would probably help shape the nation much better in future to come. In terms of the way forward as we deal with the Omicron, the best way forward is to imitate our enemy, that is the virus, and this is what we have written in the book. We need to mutate and evolve in order to outsmart the virus. When it attacks, we defend. When it hides, we find it. When it changes course, we're right there behind it. When we need to, we call for reinforcements and resources. So we lost 28 of our colleagues at the ICMR, 27 institutes, and we remember them and pay homage to them for their contribution in saving lives for our fellow citizens. And I thank you for your attention. As I often show this slide, that attention is the rarest and the purest form of generosity. Thank you so much. I'm happy to answer your questions. Thank you so much.
Thank you, Dr. Bhargav. That was a very nice summary of the book. I'm sure now the people who are there in the session will have a sense of what has happened over the last 2 years. Also very uplifting to hear some of these numbers and statistics, because very often we live in a world where there's so much negativity out there that the positive news does not get highlighted as much as it probably should. And clearly we have achieved a lot. In the summer of 2020, when the lockdown happened and the pharma industry also went from 100% production to maybe less than 20% in the first 2 weeks, they were able to get back up. And in May of 2020, they were not only going full steam, but they exported more than 2019. So, and since that time, we have had Covaxin, we've got Zycov-D, and we have the Serum Institute vaccine, which is being manufactured in India. So many stories going from scratch when you were testing, when we had a testing capacity of less than 10 per day to more than 1.4 million per day within less than 7-8 months, where you have one facility, the National Institute of Virology, and from there to take it across the country. It is a fantastic achievement. There's no doubt about that. And so many different things to talk about. But with your permission, I just wanted to focus on a few things which kind of struck me as I read the book. And because, as an interventional cardiologist, a professor at AIIMS, for whom I have highest respect for doctors at AIIMS. My father was operated on by an AIIMS neurosurgeon for pituitary macroadenoma, and I was blown away by his combination of competency and compassion, which I think is the hallmark of all great doctors. And coming from that tradition, I suppose that one couldn't be in better hands in a place like you are in. And so based on that, I just thought to ask you a few questions on some aspects and what your thoughts are on how we can move forward as an industry, especially the pharma industry, for example, but more generally as a nation as well. So my first question is on research, good research. On one of the pages of the book, page 75 actually, you kind of talk about what constitutes good research. And with your permission, if I can just read that out, you say that the goal of research is to generate knowledge through hard data, and conducting this trial taught us that, so this is in the context of that 464 plasma trial, which showed conclusively that it actually doesn't work. Taught us that successful high-quality, large-scale trials are rooted in capacity building, training, and having respect for local health systems. We learned that, as in other areas of life, generating evidence is also best done by fostering trustworthy relationships with effective communication, clear ownership, and teamwork at their core. Now, this actually is a very interesting point that you make, because good research therefore depends on the management of people, on getting together teams, on fostering relationships, on fostering trust. So you've been with ICMR now for 3 years, and previous to that you were at AIIMS. So may I request you to share with us a little bit about how you have developed these dimensions in the people that you have worked with, which has led to some of the outcomes, I'm sure, that we have seen over the last couple of years.
Thank you so much. I think the most important point which I want to emphasize regarding good research is, number one is that we should have a very clear question. The framing of the question for the research is most important. Otherwise, I mean, half of the battle is won if your question is very clear. That is number one. Number two is the fact that when you have the question, it should have some, at least for medicine, some public health impact in terms of it should have translational value and public health impact. And what I found, and what has been a problem with research in India, and probably in many parts of the world, is that many of the researchers like to remain in their little isolated space and keep tinkering with high-end research, many times very high quality, but they do not work as a team. Working as a team was what probably I was able to establish and see at ICMR in these last 4 years that I've been here, was the fact that two scientists would not work together, two labs would not work together, two institutions would not work together, two science agencies would not work together, two government agencies would not work together. And what we learned from this pandemic was the demand was there, and everyone realized that we have to get above board our personal issues, our personal agenda, and try to get something for the nation. And probably that was because the time was demanding, we were able to get that together. And I've tried to nurture that and request everyone to work on this philosophy in the long run, because this momentum that the country has got, the science agencies have got, the industry has got, I think that momentum should not be lost.
It's interesting you should say that, because in the last 2 years, for the pharma industry as a whole, there's a research policy, there's an innovation policy. The Prime Minister put out with support from the industry and the Ministry of Department of Pharmaceuticals and the Ministry of Health and Family Welfare, the research policy, innovation policy. I was involved in the construction of the innovation index and so on. So clearly progress is being made. But sometimes one thinks that institutionalization of those processes is something of a challenge. And if I may quote an example, maybe scale has something to do with it. In my own discipline, for example, the top 20 universities in the States taken together would have more than 1,000 professors who are what one could call as world class. Whereas in my same discipline here in India, across maybe around 8 or 10 institutions, the total number of professors who could be in that caliber would be a lot less. And without that scale, therefore, it becomes difficult to get the kind of work that is possible in larger teams. Simply the formation of those larger teams requires a certain number of people of a certain caliber. So I was wondering if I could kind of push you a little bit on that to get your opinions on how one might do that across disciplines, including the pharma research. I mean, the newer areas of research, computational biology and genomics and cells chemistry and so on and so forth. How does one create that scale over here in this country?
I think that's a very important question that you have asked. The most important thing, again, and I would like to emphasize, we have to get out of our silos. I mean, I had, when I was at All India Institute, we started a small program with the help of Stanford University called the School of International Biodesign with IIT and AIIMS. And we were, within a span of about 8 or 10 years, we were able to train more than 150 young innovators, which included doctors, engineers, designers, entrepreneurs, and developed more than 40 medical devices with more than 15, 20, 16, 17 startups. I think more important is we have to get out of our silos. And as I had mentioned, the 4 words in our private-public partnership, that mutual respect, time-bound, and transparency and trust, that is very important. And that is important for scaling up. And it has to, and you're right, we don't have that many people. The critical mass is less, yes, but I think the direction is right and we need to build on it. And I think the general mood in the country is also very positive for developing things. And importantly, most of our research agencies their endpoint is either completion of the experiment or getting a grant or getting a publication. They have to rise above that in terms of getting a patent and then getting a product which is translation.
So
those are the two important.
So if I may interrupt you, sir, on that particular issue, going beyond the patent, also, if you look at institutions like Stanford, where you have some associations, or MIT and so on in these places, UT Austin, where I did my PhD from, the engineering school, the medical school, they tend to have they collaborate very closely together. By the way, IIT Kanpur is finally doing that, also my alma mater. But not only do they collaborate, but they tend to have a technology transfer office. They call it a technology licensing office, which actually acts as a bridge between the scientists and the commercial world in a sense. Because let's face it, good scientists almost by definition are not really trained and able to look at the commercial side, at least the ones who are going to make those path-breaking discoveries, most of them. A few obviously will have that smarts and the skills. But I don't see that in the NIPERs over here. I don't see that. I have very little understanding of how ICMR works. I'm hoping that ICMR does something of that. CSIR, some labs, I think, have made some tremendous strides in that direction. National Chemical Laboratory, for example, I'm aware, has done some excellent work in being able to transfer technology. So what are some steps that ICMR, for example, has taken in this direction, or AIIMS, in your experience, has taken?
Yeah, I think 2 or 3 points are here. One is that we have at ICMR developed an entrepreneurial policy. I mean, you would be surprised to know that if a physician in any of the 600 medical colleges in the country invents something, he is not getting a share of this, anything. That does not exist in medical colleges. It's there in all IITs, it's there in engineering schools, it's there in some CSIR laboratories, but it does not exist in medical colleges. And it's generally, you're there, see the patient, take care of him and forget about it, or teach the students. That was never there. So we've developed a policy for the whole nation, for all the medical colleges, that they should also be part of the story. That's number one. Number two, the entrepreneurial policies that are there at Stanford or MIT, I don't think that we can cut and paste in India. We have to have a clear balance, and I often compare Edison with Gandhi. And Edison said, I don't want to invent anything that doesn't sell. Well, Gandhi said there is a thin line between need and greed. So we have to have a balance between the two. I don't think we are doing innovation to create millionaires. We have to do innovation to solve problems, and we may become millionaires by the way. I think that is probably the bottom line.
How interesting and wonderful to hear you say that. In fact, that leads into when you said that we cannot copy paste from Stanford or MIT or any place for that matter, Cambridge or Oxford. On page number 112 of your book, you have a statement. It was the Macaulay mindset at work. What had Macaulay done? He framed India's education policy. He said that if the East India Company had to rule over this country, we have to systematically destroy its education system, drilling every Indian's mind that the Indian education system is inferior to that of the British. This was instilled in 1835. It is this Macaulay mindset which is responsible for a lot of people in India being extremely critical of things in India. I sometimes say that we got our political independence in 47, perhaps our economic independence in 1991, but we still have not got our intellectual independence.
I think that's exactly, and you've hit the nail on the head, that we haven't got that intellectual independence. And I think these examples of how the country fought against COVID, whether it be testing, whether it be infrastructure, whether it be vaccine development, whether it be drugs or pharmaceuticals, should give us confidence, and particularly the next generation. And I've mentioned some points about how social sciences should be built into the medicine and engineering sciences, really the STEM. And that mindset was probably a full-rounded development which used to happen in what we read in our yesteryears as far as our country was concerned. But with so many years of foreign rule, that really got erased in a big way. And that self-confidence has to gradually develop. Yes, it is happening. I see what my earlier generation was and what my next generation is. Whether it be public speaking, whether it be science, I think they are far more confident, far better. And that sense of national pride has to be somehow instilled along with that self-confidence. And that will
so true.
Long way.
So true. But I believe we are making progress in that direction, and hopefully we will continue to make more progress in that direction. That pride in being Indian and doing stuff over here in India. Clearly, we are already doing pretty much well. Sometimes, pharmacy is the area that could perhaps do for India what software did in the 90s and 2000s and 2010. So healthcare and pharmaceuticals and medtech might be those areas. And perhaps ICMR has a lot to contribute to it. Let me move to a little bit of a different topic and ask you about your experience. You were a professor at AIIMS, an interventional cardiologist. And by the way, I feel so happy that you had that profile before, because interventional cardiologists have to make split-second life-changing decisions, and they get comfortable with making decisions. There are so many people who have trouble making decisions. So when you compare AIIMS as an institution and ICMR as an institution, how would you compare and contrast these? What are some strengths over there which you have tried to bring over here into ICMR? What are some things in ICMR that AIIMS could learn from?
I think AIIMS is a great institution that has nurtured so many doctors who are in different parts of the world. But one point is that AIIMS is an island of excellence. And for a large country like India, people sitting in ivory towers have to come down from their ivory towers for the public health perspective. That disconnect has to be taken care of. You mentioned about pituitary adenoma, and that is the transsphenoidal surgery and the endoscopy that is done. I mean, yes, we have to have centers of excellence for the same. Having said that, a certain basic public health level has also to be achieved, and that public health concern has also to be there in everyone. That is the little difference that I can see between the governance of AIIMS and the governance of ICMR. If I were to compare it, it would be AIIMS governance is more American style, very liberal, lot of discussion, lot of openness and everything, but not that much of discipline. In ICMR, you have more a British system, which is slightly more hierarchical, slightly more disciplined than ICMR, than AIIMS. And in the time of a pandemic, this probably worked better than that would have worked. This discipline was important, hierarchy was important, single command was important. And yes, there are strengths in both the systems, there are weaknesses in both the systems. And I think a good mix and match of both would be an ideal situation.
So in a sense, if I then use that to kind of go back to the beginning, when you made the proposal, the suggestion that we need to go for a lockdown and ban international travel. Please walk us through the motivation, the analysis that led to that, because that was a very, very, one might almost call it an extreme step to take. Clearly warranted in retrospect, but everybody has 20/20 hindsight. At that point, what kind of led you to it?
Yeah, as you have mentioned, I mean, I'm not a public health specialist. I'm an interventional cardiologist, and I've learned a little bit of public health along my course at ICMR. When I joined, immediately we had the Nipah outbreak, then we had the Zika, then we had the canine distemper virus, and so it was just bang, bang, bang as I came here, and then COVID came. Now, and decision making is very important, and as if we make 10 decisions, 8 may be right, 2 may be wrong, or 7 may be right, and 3 may be wrong. But you have to weigh them in terms of their strength, and many times you have to give a quick decision very rapidly. So the fact that we had recommended to the leadership regarding the lockdown was because at that point in time, the whole world didn't know anything about this virus. India was underprepared in terms of the resources, in terms of know-how, in terms of caliber, and we had a very, very large population. Now, decisions are not taken for a particular person or a particular household or a particular city. Or if you're taking it for the entire nation, it has to be something which is pragmatic and can be useful. And that is what we discussed, debated, made a presentation to the leadership and discussed with him all the points about it. And we were asked to suggest 2 points, and this is how we really suggested it. It was earlier with the group of secretaries, then the group of ministers, and then finally with the major leadership. We had to go through the whole. We started talking about it in the first week of March, and then we made a presentation to the group of ministers, then the cabinet secretary, the group of secretaries, then the group of ministers, and then we were ultimately asked to present to the leadership. But before that, we had talked to the cabinet secretary as well as the secretarial leadership and mentioned, and they wanted a one-pager be given on what should be done. And the very next day, we took these 2 lines and gave it to the cabinet secretary, and he said there is tremendous clarity of thought. And I said, yes, this is what can be done in the resources, in the limited, considering the whole scenario for the nation.
And then as things unfolded, clearly as DG of ICMR and Secretary Health Research, Ministry of Health and Family Welfare, you would have been a kind of a nodal center for a lot of information flow and also of coordination. Now, I do know that from the pharma industry perspective, there were these numerous WhatsApp groups where the industry captains got together and they were meeting every day at 10 o'clock in the morning, and the Secretary General IPA was meeting at 2 o'clock in the afternoon. And literally people were making calls from the morning till the evening and coordinating in a very, very intense fashion. Even traditional competitors were cooperating with one another. I'm pretty sure something similar would have happened in the ICMR one also. My question to you is that was a time of crisis, including the second wave, perhaps a time of crisis. In times of crisis, people understand we're all in the same boat. We need to pull together and they cooperate and things get done. But once the crisis recedes, there is a tendency to go back to business as usual, if I may call it that. What is your sense? Do you see that happening? Or
I think, yes, you're absolutely right. And you've hit the nail on the head. We have, in a time of crisis, everyone works together. But if I were to say, and if I were to look at the problems in the country, I think we could identify crises which are there. And I have told much of my scientists, as the second wave had to really come down, I told them, be like a good football player. Don't go where the ball is at the moment. Go where the ball is going to be. And I think that is probably tuberculosis. We have a huge problem of tuberculosis. And I think if that is perceived as a crisis, then everyone will work together. Similarly, there are crises in every sphere in the country. And if people focus them as crises, I think they will work together.
So if I may, sir, suggest to you a little alternative, which is putting in place systems and processes rather than depend on crises to keep driving people. What might be some systems and processes that one might put in place in the pharma industry, at ICMR, even in other places, governance-related institutional mechanisms, so that things happen much more automatically? Arguably, I'm a proud Indian. I spent 12 years outside, got my PhD at UT Austin. I taught for 8 years at London Business School. I came back here in 2004, and I've been here for a while doing my bit in the country. But one thing that I do notice is that institutional mechanisms are not as organized in this country. They seem to work better. I have no clue. I'm not a social scientist in that area. I have no clue why, but they seem to work better in, let's say, Britain or in America. So I often wonder what might be these institutional mechanisms in the pharma industry, in ICMR and CSIR and in the automotive industry that make it a little more systematic, that allow us to get data in time, to make decisions more effectively, more quickly, and they may not be dependent on an individual. It's not all the time that you have a person like Dr. Balram Bhargav sitting in that particular chair, or Dr. sitting in the CDS CEO, or a certain other person sitting in different places. You might have somebody else if the system may not work.
Yeah, I think you're absolutely right. Systems have to be placed, and obviously systems will remain forever. That is what I have witnessed at ICMR in this 111-year-old history of this institution. There are certain systems which have really developed and matured over time. And as you are alluding to, the universities and organizations in the West, where they have also developed their systems. Yes, we do have to work on these systems, but the traditional Indian mindset is to break a system. We have to checks and balances of either penalties and reward for not breaking those systems and maintaining those systems. And setting up systems is the most difficult task. Breaking them is the easiest.
So, Dr. Bhargav, I would really love to continue to have this conversation. It's so stimulating to talk to you, but I think I'm out of time, so I have to open it up for questions to the audience. So I'm going to request Anurag, if there are any questions from the audience for Dr. Bhargav, if you will give us another 4-5 minutes, we may have some time for some questions.
Sure.
Anurag? Vidhi, are you there?
Yes, sir. So I think the questions that have come in, you've already addressed that as part of the conversation. You can please feel free to take on additional questions that you might have.
So I have one personal question for Dr. Bhargav, which is that, so now that, God willing, inshallah, the pandemic seems to be on its last legs. Hopefully it is now mutating into a somewhat severe flu, no more. What next for ICMR? And what next for Professor Balram Bhargav?
Well, I think as far as this pandemic is concerned, we know that we are still not yet there. I would not like to call it as a seasonal flu still. We are seeing some people with Omicron, particularly those with comorbidities of heart disease, lung disease, kidney disease, liver failure, cancers, associated conditions, being admitted and going on ventilators and many times not making it. So we are still keeping our fingers crossed. And as you said, inshallah, I would agree with that. In terms of ICMR, I think the 2 or 3 things. One, as you have suggested, and we have been trying to work on, and some of them is get systems in place. You're absolutely right. Systems have to be in place. Specifically with the announcement and with the problem of tuberculosis being a problem, that has to be addressed in a big way. The third thing is that we talked about the entrepreneurial policy for medical colleges, and therefore faculty at medical colleges have to be upgraded, maintained in terms of motivated to stay there and constantly innovate and be energized rather than be in a comfort zone. And we have to deal with and I'm being a cardiologist, we'll talk about the non-communicable diseases, which are contributing to more than 60% of the disability adjusted life years lost in India. And these are preventable. And therefore, we have to tackle these problems: diabetes, hypertension, smoking, cholesterol, alcohol. These issues will go a long way as far as the health of the country is concerned. In terms of the pharma industry and the vaccine industry, typically we have been in the and probably also for the IT industry, we have been in the game of not coming up with anything really majorly novel in the country. We are making generics, of no major new drug discovery. And obviously that is going to take time and money, and we have to be mentally prepared that a lot of money may be spent without results. We have to be able to play that gamble, and that some, resources are available in the country for new innovation, new IP, and trying to develop more and more indigenous products which have a new IP. That is going to be most important for the next few decades as far as India is concerned. You are absolutely right in saying that medtech, drugs, pharmaceutical products, as well as vaccines, revolution will have to be seen in India in the next decade or so. And India will have to, if it is to continue with that revolution, we have to develop new drugs, and new drug discovery has to happen. New vaccines have to develop, and teamwork is important.
So, Professor Bhargav, with your permission, I will share the faculty equity policy that we have here at IIM Ahmedabad when we take equity in companies that we're advising or we develop patents. We are allowed to get some royalty. So, with your permission, I will share that with you. Maybe it will be useful for you.
Absolutely, that'd be wonderful.
We do have a couple of questions which seem to have come up. Is ICMR collaborating with other pharma companies for vaccine development? And because our greatest learning are from our failures from Dr. Kailash Gupta, what were 3 failures that we have learned from?
Yeah, we are collaborating with other pharma industries, yes. Other vaccine industries, yes. Not only for COVID, but also for other diseases like dengue, chikungunya. We are also in a hunt, and we are also working with certain agencies for developing a vaccine for tuberculosis. If that can happen in the next few years, I think that will be something which could be a game changer as far as I'm concerned. And that is a single focus that we are having at ICMR for tuberculosis. In terms of mistakes, yes, as I mentioned, 7 out of 10 may be right, 3 out of 10 will be wrong. We have taken some decisions which have been wrong. We have made some mistakes. We have not communicated that well with the other science agencies or public at large. We have utilized data, yes. Internally, we've shared it with other agencies, yes, with the ministries and the. Having said that, the problem with the mindset of the current generation is the inability to recognize that human biology, or biology for that matter, is a stochastic science and not a deterministic science. And that is a problem I was facing at All India Institute day to day, and I face with several other agencies and institutions who feel that data will answer everything. Yes, it may answer, but it will answer is not there for biological sciences. If you look at the Six Sigma rule for Motorola, it does not work for the human body. The human body has the capability to heal on its own, which none of the mobiles or computers or electronic products will do. So that mindset change also has to come in the population at large, who have been so much immersed in the electronic devices that they have to come out of them to again, I would emphasize on the social sciences and also emphasize on biological sciences and their significance. So that has to be woven very, very carefully.
Thank you so much for your insights, Professor Bhargav. It was such a pleasure and privilege. Thank you for giving us the time to the Alumni Special Interest Group of IIM Ahmedabad. I'm sure people would have enjoyed your insights, and I personally would like to give you my thanks for having this conversation.
Thank you so much, Professor Sahai. Absolutely a pleasure. Thank you so much.
Thank you.